I am Dr. Adam, and with the Bright Minds at Beatrice, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters.
Dr. Adam, are you in there?
Will?
Hey. Oh, doctor. I need help.
Okay, have a seat, quickly.
I will do no such thing.
Okay. At your own pace, try to sit.
He's been like that for a while, Doc. Everything hurts him.
Don't be so dramatic, Bill. It's just my lower back. And it does move down to my leg, but it's not everything.
You're obviously in pain. But why?
You think? Gee, Doc. What a profound realization.
Have you experienced any illness or injury recently, Will?
No. Well, not that I can think of right now. Just fix it, Doc. I beg you.
Yeah. Hey, Saul. I'm gonna need you here ASAP, okay?
Hello, gentlemen. What seems to be the Whoa, what's wrong with you?
Oh, you little...
I didn't even touch you, Dad.
I see.
Your diagnosis, doctor?
He's in a lot of pain.
Gee, you think? Why is it so much?
Okay, so there are two kinds of pain, Will.
As if one wasn't bad enough. What are they?
Acute pain is severe, sudden, but resolves within a certain amount of time. Such pain is often experienced when there is an illness, injury, even after surgery.
It's that one. I have that one.
Hang on, Will. We still got the other one to talk about.
Okay. Keep going.
Chronic pain is persistent, lasting for months or even years.
Maybe I have that?
Pain can also be classified by the kind of damage it causes to your body. There is nociceptive pain, which is basically caused by tissue damage, or neuropathic pain, which is nerve damage, which is what I think you have.
Mm-hmm. And how does that happen?
Neuropathic pain is caused by disease or injury to the nerves. That damage can interfere with the way signals are transmitted and cause pain that is abnormal.
Interesting. So you're telling me other people feel this?
Approximately 7% of people suffer from neuropathic pain. The number of people suffering from neuropathic pain will most likely increase in the future. As the aging population grows in number, the rate of obesity also increases, as cancer patients receiving treatments which cause nerve damage continue to survive.
Excuse you? I'm not that old. And, I guess maybe I am a little overweight. So other than the immense pain, what else do I need to look out for?
Here, check out these risk factors. Adam, you mind helping me with these?
Absolutely not. The first on the list would be abnormal functioning of the immune system, which leads to a variety of different types of diseases.
You're starting off on quite a scary note. I hope they're easier to swallow after this.
Cancer is a big one, because cancerous tumors may push against or crush nerves.
Oh, great. Spoke too soon.
Come on, Bill. You know we're doing this to educate you just so you know how to better yourself.
Fine. I guess you're right. Carry on, Dr. Soul.
Well, something that a lot of people might overlook is traumatic experiences. Basically, anything that results in an increase in pressure on the nerves.
This is what happens when you eat all those chili dogs and I have to endure the car ride back home. You did this to me.
Come on, Dad. better out than in, as some people say.
Moving along. Up to 70% of people with diabetes suffer from nerve damage, medically termed diabetic neuropathy, which becomes more likely as the disease progresses. We thought that Jill might have had this at some point.
My Jilly Poo?
Calm down, Bill. It was just some muscular tension in her back.
Oh, right. Oh, thank goodness.
Ahem. Back to me now?
Right, so medications one takes, such as some cancer treatments, have the ability to cause nerve pain and nerve damage.
Then we have motor neuron diseases, which is when specialist nerve cells in the brain and spinal cord stop working, thereby causing pain.
It doesn't have to be that extreme either. Deficiencies in vitamins B6 and B12 may produce symptoms of nerve pain and nerve damage, including weakness or burning sensations.
And speaking of deficiencies, excessive alcohol ingestion may cause nutritional deficiencies that can result in nerve damage.
Doc, please stop this. You're taking everything away from me.
Last one, Will, we promise.
Oh, okay. If you insist.
Certain infectious diseases affect the nerves in the body, including herpes.
Well, good on that end.
So you see, there are many reasons, and it can really impact a patient's quality of life. Sorry.
But that's not all, Will.
Whoa. He just said the last one.
I'm about to mention the effects, Bill. Completely different.
Too much information.
Easy for you to say when you're not the one in pain. Take it away, Doc.
Neuropathic pain has been associated with an approximately threefold increase in the use of healthcare resources.
Whoa, little nuggets of information. Interesting.
Diabetic neuropathy, a common cause of neuropathic pain, is associated with annual direct medical costs of $10.91 billion for its treatment and complications.
Who has that kind of money?
So neuropathic pain significantly contributes to indirect costs associated with an increase in people being absent and decreased productivity at work, which has been estimated to a total of $100 billion each year in the United States alone.
Again, who has that kind of money?
Patients with neuropathic pain are more likely to have comorbidities, which includes coronary heart disease and depression. Last one for real now. Patients often have difficulty initiating and staying asleep. This leads to sleep deprivation, which can increase anxiety and depression, which can interfere with a patient's ability to function. And you can know more about all of this in our other episodes.
Who does he keep talking to? We're right here.
So if a person's history suggests the presence of pain resulting from nerve damage,
Us as doctors will use several screening tools to assess the signs and symptoms.
once a diagnosis is made, the doctor will create a treatment plan to manage the pain.
Well, what are you waiting for then? Let's get cracking.
Don't worry, Pops. They're gonna fix you.
Go home, Bill.
And while we do just that, catch up with what we've talked about in the waiting room.
But before you and everyone else at home goes as well, you gotta know, neuropathic pain is a serious condition and one of the major causes of disability. If you feel you are suffering from this, please visit a doctor. They will diagnose the pain and suggest medication and exercise accordingly.
Now, just in case you missed anything, neuropathic pain is caused by injury to the nerves, is often chronic in nature, and is estimated to affect 7 to 8% of people. Neuropathic pain often seems to have no obvious cause. However, certain risk factors like trauma, diabetes, nutritional deficiencies, cancer treatments, and HIV can increase the chances of developing neuropathic pain. Neuropathic pain negatively affects a person's quality of life and is associated with sleep deprivation, anxiety, and depression. After thoroughly screening a person for signs and symptoms of neuropathic pain, the doctor will create a treatment plan to best manage the pain once a diagnosis is confirmed. You know, your health matters. Yeah, exactly. You can visit the below website to gain more information on health and wellness and access the Health Matters with Dr. Adams' series of videos. If you feel you need further healthcare and wellness information, you may consult with your family doctor.